If you have a rotator cuff tear and you'd like to get rid of your shoulder pain without needing surgery, then this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'll share 5 exercises to relieve shoulder pain from a rotator cuff tear without needing surgery. Now, these exercises are going to start from the easiest, most basic ones to the most advanced. So you probably won't be doing all of them at the same time, but there may be some overlap. So let's get into the first exercise. The first exercise is to improve the mobility in the shoulder joint, and particularly the back part of the shoulder joint. 3 of your 4 rotator cuff muscles are actually in the back of your shoulder. There's also a capsule around the shoulder that helps hold the ball in the socket. Now, if that back part of the capsule gets too stiff, it can push the ball of the shoulder forwards in the socket, which can actually make you pinch your rotator cuff tendons against the arch that runs over top of the shoulder. And so it's really important to improve the mobility of the capsule, particularly in that back part of the capsule. To do that, we're going to do an exercise known as the sleeper stretch. This is to help improve internal rotation, or the motion of reaching behind your back, but it also stretches out the back part of your shoulder capsule. To do this, you'll lie down on your side as if you were going to sleep and put your arm at a 90-degree angle to your body. Now you're going to take your other hand and put it up on top of your wrist and press down towards the table. Now this is the classic version of the sleeper stretch, but many people will experience shoulder pain right here as they're doing it because this is an impingement position where your arm is flexed, adducted, and internally rotated at the same time. So there's a modification you can do of this where you take your other hand and put it right on the front of the shoulder. You'll push with your good arm against the sore shoulder and then just let this arm go down. Sometimes just the weight of gravity is enough to stretch out the back part of the shoulder, and you should feel a mild but comfortable stretch in the back part of the shoulder when doing this. If you feel a stretch, but it's not enough, just push down a little bit more with your elbow. But again, don't take it to the point of pain. You don't want to feel pain, particularly not in the front part of your shoulder. So put pressure down, let the arm drop down. If you need a little bit more intensive a stretch, just press with your elbow a little bit, and ideally hold this for several minutes. Up to 20 minutes, but most people can't go that long, so shoot for 5 minutes to start. Again, this should be a comfortable stretch. If it's too intense, you won't be able to hold it long enough. So that's the first one, just to improve the mobility in the shoulder capsule. Next, you need to improve the range of motion of internal and external rotation of the shoulder. To do that, you'll take a towel and put it underneath your elbow. Then you'll lay down on your back. Now the towel is important because it keeps your elbow above the plane of your body. If your elbow drops down too much, that again pushes the ball forwards in the socket. So it's very important to have a towel and make sure that your elbow is not falling backwards. Now take your other hand and put it on the front of your shoulder. And now you're going to use your rotator cuff muscles to rotate the shoulder back and forth. It's very important, again, with this just to go in a pain-free range. Going more is not necessarily better if it causes you pain. Because if you do have a rotator cuff tear, if you're causing significant amounts of pain, above about a 2 or a 3 on a scale of 0 to 10, then you may actually be making the rotator cuff tear worse. So go back as far as you can comfortably, and then go forwards as far as you can comfortably, and just go back and forth like this 20 to 30 times. You want lots of repetitions, but again, very gentle. This improves the range of motion of internal and external rotation, which are the rotation motions that your rotator cuff does. Now beyond that, we're going to be sitting or standing for the rest of the exercises. The next exercise is going to use an over-the-door pulley. In general, pulley exercises aren't my favorite, but in the case of rotator cuff tears, they can be helpful for active assistive range of motion. What that means is you're using the power of your own arm, and the other arm using the pulley is helping it along. This helps if you have too much pain moving your arm against gravity under your own power. Now, there are a few nuances that make a pulley exercise more effective. In general, when people do these exercises, if your palms are facing forwards like this, your shoulder's actually in a little bit of internal rotation. And even if you do it this way, you'll notice you're kind of coming up and towards midline, which also puts you in a little bit of internal rotation of your shoulder. But when you're raising your arm up overhead, you actually want external rotation of the shoulder along with moving your shoulder blade up at the same time. So it's not just an arm movement, it's combined shoulder and arm moving upwards while your arm is in external rotation. For that reason, I don't recommend sitting back to door like this, but actually sitting sideways to the door like this. Now you'll take your arm and put it up against the door. So this is the arm we're going to be working. You'll use this arm to help it along and then kind of shrug up as you get to the end range here. So you may need to choke up on the rope a little bit with this hand. Externally rotate into the door. This keeps your arm from internally rotating that way. And then go up, give a little shrug at end range, and then come back down. Slide the arm up the door in external rotation, give a little shrug at end range, and come back down. Again, you want to do high repetitions with this. If this is too painful though, just go through the range that you can comfortably. And over time, as you're able to go farther, you'll go progressively higher and higher up the wall. Shoot for about 30 total repetitions, whether you do 1 set of 30, 3 sets of 10, 6 sets of 5, break it down however you want to. But again, just lots of range of motion in the range that you can, pain-free, maintaining external rotation of your shoulder and allowing the shoulder blade to shrug up at the end. Now, after you've done that, now we can move on to more active forms of motion. This next one is also going to be a little bit active assistive, but it'll require a little bit more shoulder strength than the pulley. For this one, you're going to stand facing the wall and then slide your arms up the wall this way, shrugging your shoulders at the top. Again, you want to maintain shoulder external rotation, so your forearms should be relatively parallel. You don't want to let your elbows flare out to the side. Additionally, it's important to get that shoulder shrug so that your shoulder blades move up along with your arms. Hold that top position for 5 to 10 seconds and then slide back down. Slide up, shrug, hold that top position for 5 to 10 seconds and then slide back down. Slide up, shrug, hold it, and slide back down. Again, trying to maintain that shoulder external rotation position the entire time. Now the next exercise is going to be fully active, where you're not using the arm. It'll be a similar motion, but instead of being more of a shoulder flexion motion going to the front, it's going to be a shoulder abduction motion going out to the side. For this, you'll want to stand with your back all the way up against the wall. Make sure your lower back is flat, even if your upper back rounds a little bit. Then try to pull your shoulder blades back towards the wall and tip your arms back towards the wall. It's okay and even very likely that your arms won't come all the way back against the wall. So pull your lower back flat against the wall, lift your chest, external rotation of the shoulders, and then just try to slide up like that as far as you can comfortably, and then come back down. It's very likely on this one that you won't get all the way to the top, so just keep your arms in a range that you can comfortably, going up, and then back down, and again trying to maintain that external rotation of the shoulders. Now, once you can do that, the next step is moving on to using resistance. And to learn strengthening exercises for your shoulders, plus how to do them without further injuring your shoulders, check out this video over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.